Section 1 of the 12th chapter is an informal discussion among French peer support workers. They were specifically asked to discuss category number 11 of peer support skills. This category, which includes 7 skills, focuses on promoting leadership and advocacy. 1. Uses knowledge of relevant rights and laws to ensure that peers' rights are respected. The discussion illustrates the fundamental role of peer support workers in advocating for user rights, particularly within mental health services. Peer support workers, as described in the shared experiences, play a crucial role in identifying rights violations, such as the abusive use of isolation or restraints in psychiatric hospitals. In the interview, Juliette Vaillant and Mathilde Sabre also support the implementation of initiatives like quality rights audits, which aim to assess and improve practices in favor of patient rights. For example, an audit was conducted in a hospital respecting user rights, such as the absence of restraint or forced isolation, showing exemplary practices. In contrast, other situations reveal serious violations where patients' fundamental rights are ignored, highlighting the need for peer support workers to monitor and advocate for improved practices. 2. Advocates for the needs and desires of peers in treatment team meetings, community services, living situations, and with family. In their work, the peer support workers affiliated with the World Health Organization Collaborating Center in Lille mediate between patients and care teams by highlighting the individual needs of users. The testimony of one of them who experienced unnecessary restrictions in psychiatry illustrates how peer support workers, in general, can intervene to defend the dignity of patients. They also help raise awareness among families who are often poorly informed about procedures, such as involuntary hospitalizations. For example, mediation clarified to a family that the decision for involuntary hospitalization came from the doctor and not from their own signatures, thus facilitating reconciliation and mutual understanding. 3. Uses knowledge of legal resources and advocacy organization to build an advocacy plan. Peer support workers actively participate in the development of strategic plans to defend patients' rights, collaborating with organizations such as the World Health Organization Collaborating Center. For example, the contribution to the Quality Rights Program includes clear recommendations to improve the conditions of users in psychiatric hospitalization. These initiatives allow health structures to evolve towards human rights-centered practices. Peer support workers also encourage the use of tools such as recovery plans and advanced directives, which give users greater control over their care and help prevent abuse. 4. Participates in efforts to eliminate prejudice and discrimination of people who have behavioral health conditions and their families. The discussion highlights the efforts of peer support workers to combat the stigma associated with psychiatric disorders. They play a key role in destigmatization by sharing their own experiences with illness and demonstrating that recovery and contribution to society are possible. Juliette describes how her work aims to show that people with psychiatric disorders can also be competent researchers, educators, or mediators. Peer support workers also contribute to academic research, bringing a unique perspective based on their experiences, which helps change social perceptions. 5. Educates colleagues about the process of recovery and the use of recovery support services. Peer support workers play an educational role with health teams, introducing recovery concepts and showing how to integrate them into care. This is recommended as a first step to raise awareness among health professionals and future peer support workers. It is also important to better understand their own limits and develop skills to support others in their recovery. Mathilde shares the impact of the MOOC Fundamentals of Recovery on her perception of care, stating that it helped structure her own recovery plan and acquire concrete tools to better assist other service users. 6. Actively participates in efforts to improve the organization. Peer support workers collaborate with organizations to develop and standardize appropriate practices and training. A significant example is the development of diverse training programs tailored to different skill levels, to include a wider range of participants in the peer support movement. These efforts also include the creation of specific modules, such as those from the Quality Rights Program, which provide practical recommendations to improve care conditions and promote a culture of respect for patients' rights. 7. Maintains a positive reputation in peer professional communities. As peer support workers, Mathilde and Juliette strive to maintain a positive image by acting as role models for users and professionals. For example, Juliette shares how she used her personal experience to write a book, both as a means of raising awareness and as an educational tool. This book, which traces her journey to recovery, illustrates how peer support workers can inspire others by sharing their story in a constructive way. Such narratives reinforce the legitimacy of peer support workers and help build a strong support community.